Welcome to the next version of Trailblazers. Today's guest is a doctor, a data scientist, and a digital strategist, all put together. Aymen Elfiky is the head of oncology and hematology in the Mount Sinai System, Brooklyn Hospitals. Um, he is a part of the computing lab of the MIT Media Labs. He's been on the advisory board of McKinsey and Company, and he has a very diverse set of degrees as well. Did his master's in medicine from the Washington University School of Medicine, did public health from the Harvard University, did a course in oncology from the Yale Medical School, and an MBA from the MIT Sloan School of Management. Thank you so much for being here.
Thank you for having me.
Thanks for spending this time. This is one of my favorite topics of the power of data and digital technologies in medicine. You know, the more I read about it, I realize 80% of what doctors do today, I'm told with smart hardware, software, and data, it will completely change what doctors will do in the future and how much all of this will amplify what they do. Tell us a little bit about what's happening in the space.
We're seeing that more and more around us.
Right.
The role of mobile devices, the interconnection between the communication between the different physicians, just in terms of how we're even starting to mine the data in our EHRs and EMRs. The challenge is, again, the systemic or the scaling of these, and really the organizational strategies surrounded around this to really, to further develop the infrastructures to enable these and to better implement analytic capabilities, as well as to better integrate new technologies that would extend these abilities further. However, you're seeing the mindset, and that's the key change, right? It begins with the mindset. Still much more to come, and including attitudes that need to develop further, and that starts at the leadership levels.
And how much are hospitals geared up for this?
EMRs, EHRs, we know they were developed as for billing systems, correct? To optimize our billing.
Absolutely.
Not for clinical practice. However, as the knowledge base in medicine, oncology is a great use case, has been increasing rapidly. We're starting to appreciate the needs for that. We're starting to see the inadequacies or deficiencies in terms of our clinical operations, clinical practice, and the need to better integrate information and data that is available in these systems, but the systems are not developed appropriately there. So you're starting to see new, at the leadership level, new CMIOs, CHIOs starting to develop. Even the CIOs are starting to, to develop in terms of their role in these strategies. And first and foremost, the CEOs and the boards. You're starting to see how
And
they're
these
putting
are
their
hospital
attentions.
CEOs, you're saying?
Hospital
Hospitals,
CEOs,
yeah.
exactly right. Again, there's a lot of legacy issues to deal with in this context, but at least the acknowledgement is there. This is also driven by market forces at the same time, right? So globalism, market,
And markets
market
are,
effects.
consumers are expecting, or patients are expecting consumerism in a way, like they deal with any other service in the society.
Absolutely, and I feel that's, myself personally, I feel that's where the strongest movement, this grassroots
Right,
movement is
right.
what I feel, where again, there's more access to information, to knowledge, more involvement in your own health. This is partly driven by economics of it, rising costs of care and
Right.
co-pays, for example. So there's more expectations and more involvement in your own care. So there's more expectations of the system, and the systems and even the attitudes are not necessarily what we were used to before, but we're having to evolve to meet those demands, or else they're going to be delivered by other.
Got it. I mean, if I may ask you, one of the reports I read about is actually one of my favorite entrepreneurs, Vinod Khosla, who invests heavily on healthcare. He talks about how AI today can play the role of a radiologist, and what needs to happen is adoption of AI for the future. And by 2022 or 2023, he thinks you don't need a radiologist, and in the next 10 years, you potentially don't need an oncologist. And and the role of an oncologist will change in many ways. And he thinks a primary healthcare specialist with integrated care powered by AI, which will do the specialized job, will be the future of medical sciences. How much do you think this is true, and how much do you believe that this is coming, and we're not seeing it yet?
In radiology, we're seeing this actually quite a bit. So I think that's one of at the forefront of the impact and implications of data sciences and what it can achieve, especially and it really highlights the biases that can be inherent in practice, but especially in radiology, or the human biases, how we can be really how you can be influenced by information that's applied to you, right? But then what about if it's just again more of an open field and really applied, AI, machine learning technology is just applied to really point out a number of things that we are looking for, but a number of things that we may not have anticipated. And then you can integrate other information along with that, and you can see where AI can take you, especially from the radiological
And
perspective.
can AI do more than what a radiologist does today and actually sense cancer and oncology in a much better way?
Absolutely,
You think
absolutely,
so?
right.
Wow.
I mean, there's studies that show it's on par, but you can, on a daily basis,
And
you
it's a
see
learning model. So
it's a learning,
yeah.
exactly. It's an iterative, and it's growing, and it continues to improve.
And do you apply it to your job yourself?
I do. I mean, so I not necessarily on the radiology side. I know in Boston, where I was before arriving to New York, there was a lot of studies and a big focus that was all the forefront initial studies that were being done were in the radiologists, in the radiological sciences, in the radiology group. Over here, what I use, I'm focusing more on the clinical data, refactoring the data that's available in our EHRs, but then using data visualization, how I organize the data, how I present it to the patient, how I present it to my colleagues, to really tell the stories of the patients in a very more comprehensive and very more real way. And that ultimately does influence our decisions. Whereas when you just had more of a provincial or marginalized view of certain aspects, and you miss the opportunity for a systemic view of that patient and that condition, you really divergent choices are made,
Right.
And ultimately, this is not value. That does not translate to value.
And do you see research on AI advancing at a stage where every discipline of medical sciences will kind of be powered by AI?
It's slow in the beginning, but many things are slow. Good things start slow in the beginning, but the momentum builds up. We're absolutely seeing this, especially at the big academic centers. Certainly in Boston, at Harvard, we saw increasing integration or collaborations between the Department of Biomedical Informatics and Brigham Women's Hospital, Dana-Farber Cancer Institute, and here in New York as well at Mount Sinai. Again, strong. You're seeing the biomedical informatics and data science departments, computer science departments, increasing and better working collaboratively with the science, with the medical science departments. And ultimately, the proof is in the pudding in terms of, and this is where the challenge is, how do you test and how do you pilot and test and advance these new models within the clinical setting? This is what's slow on the uptake. But this is what's going to increase because we're starting to appreciate the deficiencies in our current structures.
Yep.
And understanding the need for more augmentation and even supplementation of our practices as they are now.
Yep. And one of the other things I kind of now started believing is, if all of this becomes real, then doctors would focus more on empathy, on ethical relevance, on human aspects of medical sciences and the cure versus the mechanics of diagnosis. And I'm guessing that's going to go a long way in medical diagnosis and treatment.
I think that's highlighted excellently by oncology, cancer care. That was actually one of the driving forces for me, especially as the range of new treatment opportunities and paradigm shifts that were occurring in oncology. But the concern was that we were focusing more on, increasingly focusing more on the computer and the numbers and short-sighted data points, less and less so on the patients and the people on the receiving end of these values. And this is this is unfortunately a feature of medicine as we move into this as part of these digital transformations. However, the hope and the very reasonable expectation is that digital transformation and technology properly applied should help to reinforce and allow us to return to that patient-provider relationship and to strengthen that and reestablish that. And that's in oncology, less, again, very critical cases, a lot of time where, the intimacy of the relationships very much needed, especially in the end-of-life care. But the that aspect does not come out in our care. There's less time to do so. There's
And
less
you would now
insight
have
into
time,
that.
more time to do that.
And we'd now have more time to do that.
Every aspect of the body is now amplified with sensors. How much is that going to play a role for data scientists? Because there's going to be a ton of unstructured data coming out of it.
Correct. Great point. And actually, in that area, I'll have a question back to you. The issue with science right now, we make many decisions based on these episodic visits, right, and episodic interactions with the patients. However, so much is happening in the periods when they're not in front of us,
They're not with
outside.
you. Yep.
Correct.
Yep.
Great opportunity that is to come from wearables and the ongoing continuous capture of data, passive capture of data, as well as integration of data from other dimensions of the people's lives.
And it's not a deliberate attempt to capture data, so you might get it more real.
Exactly right.
Yeah.
It is more real. It's more of the truth, if you will. And again, if in the clinic, if we have the time to actually sit down and actually solicit that data from that information and those nuances from the patient, it would change our interactions there, right there and then, and treatment choices we may make. However, that, again, the practice structures do not allow for that. So great expectation, great anticipation of what wearable and the data assets that will come from wearable technologies, as well as transactional data that's out there. The question, and I'd love to get your input on this, is how is this ideally going to be integrated and scaled? But what is the opportunity at an organizational level that a leader should be paying attention to?
Globally, every industry has legacy systems where unstructured data is sitting. In fact, if you go to manufacturing shop floors, there's a ton of data sitting between machines. The ability to bring all of it into a data lake sometimes is a difficult proposition. With legacy systems, the ability to create microservices so that you could access those systems and put them on a digital front end and then cross-tabulate them in a way and create statistical models which will help you to find inferences, which will help you to find deterministic values of data which is sitting there, which you do not know what the insights are from. I think we go through that with every industry now.
Mm-hmm.
And it will be very useful to apply it to medical sciences as well.
Do you think they're going to have to revamp their existing system, or is this something that could be
it could be
built
layered
on
up.
top?
It could be layered up. You could open them up and create microservices. You could put an API layer on it. You can remediate them, and you don't need to completely shut them down and put them onto new things. That's what we don't recommend to our clients as well. Our clients, we kind of say you should sustain your investments, but remediate them so that they can be exposed to digital front ends and digital systems, and that will help you to leverage the data in a very agile way.
So I'm glad you highlight that, because that's one of the challenges in my administrative or leadership role here. Building an oncology hematology division is having to keep an eye on the financial aspects of it.
Absolutely.
Right.
You have to keep the cost down, and that's what our clients say. Our clients say, look, we've invested this for years and we don't want to shut it down and create something new. Can you remediate it? Can you repurpose it and use it in a contemporary way?
You're
so
saying
we go through
absolutely
it,
yes,
and
we can.
we're very happy to help you. Switching gear, crowdsourcing is a very important part of every other industry now. I haven't seen much of crowdsourcing in the space of doctors.
It will happen better, or the hope. You see actually aspects of it. It was very siloed right now. You see a number of different sites that different that different physicians, trainees will go to as well, trying to get more real world evidence on, okay, how is somebody doing? How do I handle this toxicity or that issue? You're seeing that also on the patient sides, right? There's patient-focused groups and blogs around that.
Do doctors actively participate in those? Or?
They do, but it can be it's not necessarily curated, it's not necessarily validated. So there's a level of organization. If you take the example of peer-reviewed journals, right? You can imagine if that could then just be scaled, but to the point that's more democratizing this knowledge, and not just around one-off research projects here or there, but something more that's capturing this real-world evidence that's out there and that's at play every day, to help us deal and manage many of the real-world issues that are at play every day in clinical practice. There's a treasure of experience and data that comes from that experience of physicians out there. To mine that, first of all, to collect that, to curate that, and then to mine that for added insights, and then to be able to deliver that, to prospectively deliver that where it may be needed. You can see that as augmenting our practices. So you see aspects of that, seeds perhaps, but again, that's the hope and.
But there isn't a platform to do.
There is no app platform, exactly, and that's exactly what's needed to bring it all together.
And how would you incentivize doctors and patients to contribute to that cause?
In terms of organizational perspective, there's from a competitive aspect, holding on to our data, again, appreciating the strength of that. From patient perspective, and they have access to their data, but in this cybersecurity, cyber awareness, and just increasing concerns about cybersecurity and identity theft and whatever may come in the future. I guess the question then back to you is, what is the potential for technology, whether it be blockchain or whatnot, to more securely allow democratization of all this data?
Absolutely. I think every cloud sourcing platform has the same set of challenges, and there is a challenge of adoption. There is a challenge of how do you get on board people to contribute to it so that they see value in it and they take value out of it. But somebody has to make an attempt to start this in the space of medical. I had one last question for you. I want to squeeze this in. Yesterday I was at a dinner and I was hearing about how Google is investing so much on health that at some point of time you just have to feed your CT scan or PET scan, and they're going to tell you what the results are. And there's a lot of data and a lot of AI underneath it. How much of this is real now?
You're seeing a lot more, especially Google, Amazon. We've seen movements that they're making, Apple as well.
Yeah.
So a big push into healthcare. Their strength, I believe, is really their access to, again, to the consumers that are out there as we move into this consumer-based age. But absolutely, you can easily see how they can move from what they're currently able to deliver upon, where they can, they're always learning from your actions, from your needs, anticipate your needs within medical science.
And they have passive data as well.
And passive data as well.
Yeah.
That's a great strength. You can easily see where they're going to be heads and shoulders above what individual medical centers are able to do. But at the same time, there's a strength to come from the collaborations between the two, and you're seeing a lot of that from Google. But at the same time, with the payers, ultimately, there's a term I like to use in terms of companion analytics. You have companion diagnostics that help you to make diagnostic assays that you use to help you make the best treatment decision in terms of will this drug be efficacious or not in this case. Same thing around companion analytics, where basic analytics, AI will increasingly grow, but from a more clinical perspective, better understanding the patient at that point in time relative to the journey and their whole experience up to that point, understanding what are going to be the implications on the different dimensions of their life, in terms of their quality, and all this feeds into value. So again, this is going to come from the accumulation of data across different dimensions of the patient and population at large across their lives. This is where you see Google, Amazon, Apple, Facebook. You see where they have the advantage there. But at the same time, they do have to, and they will. They're starting. I see that at play already. Integrate with existing health systems.
Yeah, in fact, I had one other area which I'm sure you would appreciate this. Drug discovery life cycles have changed from 10 to 15 years to 2 to 3 years.
Correct.
Because of the power of data. You could move it at much faster cycles.
Correct.
Because of the availability of data.
Correct.
And I know that you're working on one of the other things. I read a paper from you which is about measuring mortality rates for oncology patients using data and analytics.
Big area. Again, going back to what we were talking about in terms of the potential to better connect with our patients. So short-term mortality. Again, it was highlighting in the paper we highlight, and it's known that physicians are not great at prognostication. Right. Again, we don't analyze the appropriate, and even our mindset where we are focused really, it comes from an honest place, wanting to do more for the patient and keep on fighting. But at the same time, we do, again, from the physician perspective, we understand the limitations and we understand, what a body can take and what it cannot. This is further informed or more realistically informed by data if it is presented and consumed the right way. And so that was the purpose of that paper, to show, really capturing, looking over the entirety of the patient's experience in the patient life cycle, the number of treatments, trends that are happening. And this is what's not presented by the EMR. But if you are able to, again, present the data and consume the data in that way, it dramatically changes your view of the patient, and it will dramatically change your approach and interaction with that patient. And hoping that this will bring back the humanism that is required and that we've been losing increasingly. The
Thank
human
you.
ethos.
Sure, absolutely. Thank you so much. That was a great way to close the note. Human ethos is probably the most critical piece of what we need doctors in critical care, especially in critical care,
Absolutely.
to do. Thank you again. Thank you again for
No, I
talking to me.
appreciate
It was
that.
such a
Thank
pleasure
you.
to talk to you. And thanks for dropping by in our office.
Thank you very much. Very nice. Thank you.